Okay, I have an amazing before and after to show you. I don't think I've seen a more profound correction with Invisalign first in terms of both expanding a narrow maxillary arch and reducing an overjet. The left is how the patient started. I had treated this patient's dad who had actually a similar problem, came, came in as an adult, and we used Invisalign. So I thought we should give it a try here. At the time, the patient had some crowding, rotations, and of course, a large overjet. Important to stress for any students out there that if you look at the molar relationship, it is slightly towards a full class 2, certainly end on class 2. This side also almost full class 2, you could call end on. And yet we have a tremendous overjet that is probably maybe 15 millimeters, if not more. And that tells you that while there is a skeletal component to this, there's also a dental component. And that, of course, is the retracted lower anteriors and the flared upper. These patients are always going to be lip suckers, whether it's chicken or the egg, whether the lip sucking caused it or whether the overjet and the skeletal situation lent itself to this gap that the patient found comforting to put their lower lip in, or it could be the thumb. In his case, I don't think he was a thumb sucker, but you might see something like this in a thumb sucker or a lip sucker. And so we did not use a palate expander. We did not use braces. This is only with aligners. We did a few refinements. We started this treatment it was in September of 2022. And here we are now in December of 2023. We waited for the laterals to come in and then we incorporated them in the system. So you see they have moved down into position. We have room for some teeth. I will note anecdotally, this patient's not yet 10, but Invisalign can lead to some loosening of some of the primary teeth prematurely, and that's okay. Nothing wrong with that. And then here is the lower arch. That's not completely surprising, but the upper expansion, I can even put up the arch dimensions, and you could see between the canine 6 millimeter increase. Between the molars, only 1, and that's really important. You could see it's about 5 from the second primary molars. What I'm saying is important there is when you look at a maxillary arch, quite often the intermolar width isn't as bad. These are mesially rotated canines, and we were able to rotate them nicely. And that can be the anchor on which the rest of the arch is broadened. Now, the question here, is this a skeletal expansion or is it a dental expansion? Well, there's benefits to skeletal expansions, but I would tell you that even though we do have some buccal overjet, like you might see after a fixed expander, you can just look at this. You don't need a transverse ceph to see that this is not a tipping movement. Or let me rephrase that. The teeth were so tipped inward, it might be a tipping movement, but we don't have any kind of crazy curve of Wilson. We don't have like buccal cusps of the upper that are like way up in the air. That would be what you might see with an adult who you try to do a non-surgical palatal expander. And so this is just a profound result. And the overjet, we're treating the upper and the lower at the same time. These cases you want to get in early because this patient would be at a huge risk at a young age from falling and cracking their teeth or a ball coming in gym and hitting them in the mouth. And also, while I do like to moderate treatment towards older, adolescents, 11, 12, 13, socially, these kind of kids might often get picked on when you have this kind of overjet. So very good to intercept it early, and Invisalign first worked out amazingly better than I thought.